Welcome back, my Be Health Empowered family, to another week of Excuse Me, Doctor. We are coming to you live. And of course, my name is Dr. Melissa Clark. Please call me Dr. Mel. I am delighted to be here with you again this week to do what we do, which is to make sure that you have all the accurate evidence-based health information that you need to make wise health decisions, not just for yourself, but for your family and even for your community. So I want to welcome the newbies that are joining us for the first time. If you haven't done it yet, please hit that like button if you're watching us on Facebook. And if you're watching us on YouTube, please go ahead and hit that subscribe button. Really appreciate you for it. Thank you so much. Now, let us get into creating an amazing week for ourselves with all the health topics that we're going to cover. And, to do that, I have to welcome my incredible co-host, Mr. Wayne Bruce, to bring us the word on the street, what's on everybody's mind. And, he actually is going to announce a surprise for our longtime listeners who've been with us from the very beginning, because we are welcoming a special someone back tonight. And you are on mute, so you can't tell us the surprise unless you come off mute.
Dr. Mel, you into my time. That's because you into my time, Dr.
Well,
Mel.
Go ahead. Take it away.
Time. This is where I get to shine on the Excuse Me, Dr. Mel show.
Take it away.
Excuse me, Doctor, with Dr. Mel. I shine here. This is me. And you were talking about all the beautiful things you wanted to do and all the guests and hold on, everybody, just hold on. Just hold on.
We are holding on. We're waiting
because
for you to make this
I gotta get my clicker together. None of this happens without the clicker. So
go ahead and get the clicker together.
I just want to proudly announce, for those who have been longtime listeners and lookers and everything, man, I'm about to cry because my ride or die.
Just keep it together. Your ride or die co-host. Where's she at?
Ride or die, there she is.
Hat, glasses, and all.
With the glasses, y'all. With the glasses.
Hey, Lila May.
How we gonna have the glasses up? Where the party going? Yo, Lila Mays, y'all.
Welcome back, Lila Mays. We are delighted to have you back as a co-host.
Excuse Me, Doctor, featuring Mays.
Hi, everybody. So happy to be back.
We're happy to have you back. And of course, Lila, for those of you who don't know her, is coming to you live from the great state of California. So we got East Coast, West Coast covered in the house.
Right.
Indeed.
Can you hear us, Lila?
I can hear you. Can you hear me?
Yeah. You want to say something for the peoples?
Hi, people. Hi, Be Health Empowered family. I'm so happy to be back. Let's get into it. Let's jump on in here.
All right. Well, it's a special show today. That's all I can say. We covered we started a women's health series where we talked about superwomen, right? The superwoman syndrome, the strong Black woman syndrome, the tendency to take on everything as women, as Black women, and all the other social burdens that we have to bear, and how that has serious effects on our health. But tonight, we are having a part 2 of that women's health series. And that is, what can our action plan be to protect our health? We are going to break it down with an incredibly special guest tonight in this episode. So it's going to be incredible, y'all.
Yay.
I'm excited.
I am excited.
Too. What's going on with my camera, though?
I don't know what's going on with my camera either. Sorry, people.
You all look fantastic. As a matter of fact, I think you all look so fantastic that it's time to get into the weekly recap.
Okay, there we go.
I think you're right.
Recap. Ooh, cha.
Right. Oh, you took the words out of my mouth. Ooh, child. Number one.
That's right. Kick us off.
Uh, Number one, is weed smoking safe for older adults? Talking about that superwoman syndrome. You know, I know some ladies who have partake or are partaking in weed. What's up with that, Dr. Mel? Is it safe? Is it not? What do we
Well,
have to say about that?
we all know older adults who smoke weed. Even my aunt, who's in her 80s, told me that at her senior community out there on your coast, Lala, literally
Hmm.
everybody was firing it up in the evening. And it was so much so that you couldn't walk the community without that thick smell in the air that you all know about. And
Yes.
research actually backs her story up. In 2020, they showed that cannabis use doubled among the 65 and older crowd. And that was from
Mm.
2015 to 2018. It doubled.
Mm.
But to answer your question about whether it's safe, there were a couple of studies recently presented at the American Heart Association meeting that found that adults who don't smoke tobacco but who do smoke weed were at a higher risk of both heart attack and stroke when hospitalized.
Right.
And people who use marijuana daily in that age group were 34% more likely to have heart failure or to develop
Oh,
heart failure.
I'm clutching my pearls. I'm clutching my pearls on that one.
What
As well we should all be. Because
what's
we
making
all
the weed unhealthy? What's making smoking weed unhealthy?
so the thing is, inhaling cannabis smoke increases the level of carbon monoxide in your blood, and that's a poisonous
Mhm.
gas. And so it's thought that that probably has, is leading to some of the poor health outcomes that we're seeing.
Okay.
And we can't 100% say that the cannabis is a direct cause of these health issues because of the way that the study was done. It was just an observational study, which
Okay.
means they sort of looked back and sort of looked at data that was already collected, and they haven't published it yet.
Okay.
But it's still something to make you go,
Hmm. For sure, especially those of us who are in states where access is so at our fingertips. Yeah.
right,
Okay.
exactly. And DC is one of those states. There's
I
going
know.
down the main drag, Georgia Avenue, there's literally like a dispensary on every corner.
Why you have to
So
bring up Georgia
Exactly.
Avenue though?
because
You
well,
know,
all I can say is until more studies are done, I would just really discourage older people from smoking cannabis.
wow.
Okay.
So what do we consider old there though?
Yeah,
Well,
I
the
think
study
that's an
was in
important question, Wayne.
65 and older was who the study was done on.
That
I'm way
doesn't
under
give you
that.
a pass.
I'm way under that. I'm good. Not that I smoke, because I got asthma.
Right. Anyway,
Okay.
regardless of, yeah, I think older adults, period, should just use with caution
Yeah,
Okay.
use
or
with
not
caution.
use at all.
So, Dr.
Noted.
Mel, it seems like COVID is the virus that keeps on giving.
Yep.
Unfortunately, not great things though. Now we're talking about getting COVID might not be one and done because of long COVID, and
Right.
long COVID is now affecting mental health.
Right. And we've known that for a while now. It's just that more and more studies are coming out on this. And I have to just say, we're at the beginning of the winter surge. So, go ahead and get your booster if you haven't gotten it. Long COVID occurs after a COVID infection. It's where, a constellation of physical changes to the body are happening because of higher levels of inflammation. And there's serious health concerns that can result anything from diabetes to high blood pressure, to now these mental health changes that we're seeing that can last from weeks to years after a COVID-19 infection. And those include things like anxiety, depression, post-traumatic stress disorder, etc.
Yeah.
And
So
so just really quickly, Dr. Mel, I'm sorry, Wayne, but Dr. Mel, how do we know if we have long COVID because of those kinds of symptoms?
Yeah, I mean, if you are, it may or may not be long COVID, but if you're having any of those kinds of symptoms, you should seek medical attention. And
Okay.
especially if you've had a COVID infection recently, that's how
Mhm.
people are linking it to the COVID infection. The more times you've had COVID, the more risk you are at higher risk for symptoms of long COVID.
Got
And
it.
people are just getting dismissed by both doctors and loved ones, saying it's in their head. Right?
Mhm.
Right. True. But this week, a panel of scientific experts came out to say that long COVID symptoms are real, just like the physical problems that we're seeing, other physical conditions that happen with long COVID. They should be taken seriously and treated as are other mental health conditions.
Wow.
Okay. Now, this last one in the recap is quite a headline. Formaldehyde, killer of Black women. What
Well,
is that?
yeah, and this is really appropriate because of our topic tonight, right? Women's health. But
Mhm.
last month, the FDA took the first steps to banning formaldehyde, yes, formaldehyde, and related chemicals that are used in hair straightening products. And the reason why is because they've been linked to cancer.
Wow. I mean, there's so many of us who have used these products straightening our hair since my mom put a kitty kit on me when I was a little girl. So I was getting my hair straightened for a long, long time. That's where we can find a lot of this stuff, right?
Right, exactly. And we're sort of at risk for it because of the discrimination in society resulting from sort of white beauty standards as the
Yeah.
norm. And so a lot of Black people, Black women, have straightened their hair to fit in, to fit that quote unquote white beauty standard. And
Hmm.
it turns out that we're spending over 9 times more on ethnic hair products and beauty products than non-Black women. So that's
Did y'all
really
hear
key.
that? 9 times more.
Yeah, it's
That is,
crazy.
that's a lot.
And what's making the formaldehyde dangerous is when you combine it with heat. So the blow drying and all that, it causes, it to get into the air and also to penetrate your skin, and it increases the risk of certain cancers, especially uterine cancer and breast cancer, which are both on the rise in the Black community. We have
Wow.
actually Black
Interesting.
women have the highest death rates from uterine cancer.
Wow.
Wow. But we've talked about this before, right, Dr. Mill? I mean, this isn't a new topic necessarily. We did a show on this a couple of years ago.
We sure did. Right around this time of the year, we had a dermatologist, Dr. Melanie Macklin, come on. And, the data on this goes far back as 1987 when the EPA listed formaldehyde as a cancer-causing chemical.
Wow.
It's just that the beauty industry lobbyists have really successfully prevented taking any kind of action on it. But the FDA is finally being empowered this month, December 2023, to more rigorously oversee the cosmetic industry.
Good.
Wow.
It's super important.
About time.
Yes, it is
Yeah.
about time. So that's the recap, y'all. What
All
else
right.
we
Yeah.
got?
Yay. Well, look, we normally go to a segment at this time that we bring in our studio audience. Like we have a studio audience.
We do.
And we gonna flip it up, but we gotta introduce Lila. I think this is perfect for her. This is,
What y'all think?
That's awesome. I cannot wait to get out in these streets and ask the people what they think about certain topics. So we're gonna kick that off
we
very,
gonna
very
flip
soon.
it. We normally ask in studio, but we're not
Hmm.
gonna ask in studio. We're gonna put Lila in the streets, right? So
Yes,
come
and
into
she's
your
good.
town.
Yeah,
If you see a young lady in a hat, gotta
and
have a hat.
glasses.
Gotta have a hat. Asking you a question. Answer the question. Because this is for excuse me, doctor.
Indeed.
Right.
Once
So stay
again,
tuned because we're going to have some great topics starting next week with Lila from the streets bringing us the word. What y'all think? There you go. Well, thank you all. I'm going to see you back in just a little bit. Um, everybody else, stick around because we are going to go into this really deep episode Um, and, we did that joint episode with Howard University where we talked about the superwoman syndrome and all the other stressors that Black women have that often lead to poor health and even untimely death. So we're continuing, though, to talk about the health of Black women, but with a different twist. We're going to be learning about how aspects of our African and African American culture can really be brought to bear to address some of the most pressing issues around Black women's health. And to do that, we have an incredible guest. His name is Dr. Byron B.K. Edmond. He is a dedicated anesthesiologist. He's the one that puts you to sleep in the operating room. He is a Morehouse man and a passionate advocate for holistic health. He founded the B. Edmond Project to address issues related to Black women's health and wellness. And he is the author of 3 books on women's health. Welcome, Dr. Edmond. Thank you so much for joining us on Excuse Me, Doctor.
Am I on mute?
No, not anymore.
All right, great. Hey, number one, hey, Dr. MEL, it's a pleasure to be here. And whenever I get a chance to talk about, women's health, our community's health, it's always a great thing. Just thank you for having me on your show.
You are so welcome. Thank you for being here. And let me start off with the obvious. You're a man, right? Mm-hmm. Some men don't want to touch women's issues with a 10-foot pole. What inspired you to start talking about women's health issues?
I came into the women's health issues because one of the first projects I worked on was to try and get some breast cancer equipment transferred over to the country of Ghana. And in doing so, I had to do some in-depth reading on breast cancer issues in West Africa. And I, learned more about breast cancer issues here in America. And in the middle of the project, my mother was diagnosed with triple-negative breast cancer, an aggressive form of breast cancer. So that really brought it home. And so I had run into a problem or identified a problem that was going on in West Africa in terms of understanding that patients were coming and presenting late in their care. So, and when discussing it with some of the surgeons, what was happening is a lot of the patients were going to traditional healers first, and then delaying coming to modern medicine. And I basically, when I saw that problem, I came up with a short story to try and address that problem and raise awareness on that issue. And that was the first story. It was called Non and the Bushwoman. And after going into that, I basically had a case where I had a brown-skinned mother who nearly passed away on the table after having a C-section. She had a C-section, but we had to go back to the OR emergently. And when I was doing the quality assurance write-up on it, I came to find that one of her major risk factors for having problems and near deaths and deaths surrounding having a child was the fact that she had brown skin. And because of that, because I'd already written a short story on the breast cancer issue, what I did was write a targeted story about how we could better protect our mothers during pregnancy. And that's called The Quiltmakers, The Art of Hearing a Black Woman's Cry. That's really how I got into it. That's where the 2 stories come from. Yeah.
And you've chosen a specific way to get the message out, storytelling. Why storytelling? Why did you choose that medium to educate about Black women's health?
Right. It's not just storytelling. I actually try to do a short story. So this is the Non and the Bushwoman is only like 30 pages long, 37 pages long. And the Quiltmakers is a very, very short story too. But what it is what I realized is that what I realized was that I had a gift where, and our family tells stories all the time. And if you come, I have a brother, Rod, a sister, my mom and dad, my older sister, Sandy, and we tell stories to entertain ourselves. And what happened was, I just come from a tradition of storytellers. And what I decided to do was see if I could take the short story format and basically introduce kind of complex issues, but make it more palatable, easier to taste, where a person reads it and doesn't even know that they're learning sometimes until we tie it all in at the end. And then when you hear the short story, there's scenes in the short story that where we can inject some truths. But that's really kind of what I try to do, is use that short story format, because people have short attention spans, and I really try and get a nice, smooth, quality short story that people can but that has pertinent and up to date information in it.
Right. And storytelling is part of our culture, right? I mean,
Absolutely.
that's how we pass information on. So,
Mm-hmm.
you mentioned the young woman who almost passed away on the operating table,
Mm-hmm.
and she was during childbirth,
Yes.
and she was at higher risk because of her brown skin. And that's one of the themes I wanted to talk about on the show, about how Black women are at higher risk for these poorer health outcomes, one of which is um, dying or having complications during childbirth. We're seeing it in younger Black women of childbearing age. And the grim statistics are that Black women die
Mm-hmm.
at 3 times the rate of
Three
white women in
times the
childbirth.
rate.
3
Three times the
times.
rate.
And it
Absolutely.
I think right there we're seeing a graphic. Can you tell us a little bit about that graphic? What's the
Sure,
significance of
absolutely.
it?
This is not my graphic. It's actually taken from a document that's been used to educate people on the problem of one of the major contributors to one of the problems with the high incidence of death, and that is called. It's what's happened in our healthcare system is we basically have community hospitals and community women's support establishments that have closed down. So you have maternal deserts that occur in America. And you basically have sick places where women have to drive an extreme distance just to get basic care. Then when you start talking about stepping a woman up to having more high or more specialized care, it's even a further distance. So one of the things that people believe is contributing to that high incidence of death in America is something called maternity deserts, and that
Mhm.
ties into a little bit about in terms of one of the contributors for why Black women die, and I'll be able to tell you more about that in a little bit.
Sure, and a lot of those look like they're in the South and the Midwest. Um,
Absolutely. And if you, when I wrote this book, Georgia was the Georgia, the state of Georgia, where where you have Atlanta, you have HBCUs, it's
mhm,
almost looked upon, and you have Hartsfield Airport, one of the most active
right.
airports,
Busiest in the
and
in
business
the
in
country, yeah.
where you have numerous businesses like Porsche, Chick-fil-A, and Home Depot, their headquarters there. The reality is when I wrote this book a couple of years ago, Georgia was the number one in America in terms of the death for Black mothers during pregnancy and surrounding pregnancy. It's
Mhm,
probably number two right now. It's dropped down to Mississippi. One of the
mhm,
things I try to drive home are some simple numbers, and the hero in the book, named Stella, is into mathematics, and what she does is she basically always just takes what God gives her in order to solve a problem. Okay, there are three numbers that I want to raise awareness of, and the first number is 3. You mentioned it, Dr. Mel. Black
mhm,
women die at 3 times the normal rate during pregnancy. The second number I need you to remember and need our community to remember is 60, because what I need you to understand is 60% of the deaths occur after the child is born. There's so much of a focus on the 9 months and carrying the child and making sure that the child is born, that people forget the fact that 60% of the women who actually have uh, major complications and death, it occurs within the first 6 weeks after the child is out and stuff. And
right.
so what we want to try and do in our book is to try and shift the support system to start focusing on supporting that mother in the first six weeks, definitely, but up to a year after the pregnancy. The last number is 80, and because recent research came out of California to show that 80% of the deaths for these Black mothers is preventable.
Yeah.
And so literally these deaths we're talking about for mothers in general are preventable, Black mothers too. But there's one other thing I want to, the reason why you're seeing this hit the news so hard right now is because in the past 20 years, while the death rate for mothers internationally has decreased by 39% in the past 20 years in America. This is for across the board, Black, white, Hispanic, everybody across the board. The mortality, the death rate for mothers since 1999 has doubled.
Yes.
From 1999 to 2019-20,
Startling. We lead in the United States. We lead industrialized nations
absolutely
in deaths of women.
That is it. So it's not just a Black issue, but you know, we catch America catches a cold, we catch the flu. So we have a higher rate. But I mean, across the board for our Caucasian sisters, the incidence of death surrounding pregnancy has doubled as well. And now, and because of that, the United Nations and UNICEF has basically identified, you know, America is one of the countries that's an outlier. It's going in the wrong direction in terms of maternal health.
So let's get into some of the reasons, though, specifically for Black women who, you know, even though it's risen for everybody, Black women still are 3 times the death rate and complication rate of everyone else. What are some of the reasons for this beyond the maternity deserts that we showed?
Gotcha. Well, the key is that it's not like how can I say this? When we talk about some of the reasons, a lot of times it's easy for me to talk about what's working. And if the death rate for per 100,000 in America is almost 21 for Caucasian women, it's actually 1.7 in the country of Finland. And sometimes instead of saying what's wrong, it helps if I tell you what is happening right in the country that has the lowest incidence of death in the world.
Okay.
So why don't I tell you what Finland's doing right? Number one, whenever a child is born in Finland, the community actually pays for about 43 items that each mother gets free of charge. And it's enough items to actually to support that child in terms of food, care, bassinet, stroller, all of those things that are needed for a mother, and clothing for a mother to care for that child for the first year. Okay. And they've been doing that for over really 40 or 50 years. And that's one of the reasons why. So what they did, the community made providing resources for the new mothers a priority. The other thing that Finland does is they have a community-based type of care. So meaning the same midwife who takes care of your first child will take care of you and your third child.
And it's a midwife. I think that's an important piece.
Absolutely. And that ties into the third issue and when you look at the workforce in Finland and Europe and the workforce in America, in terms of the relationship between obstetricians and midwives, it's flipped. In America, in America we basically allow our medical establishment to run midwives out of the practice of delivering babies. But in Europe, they held on to the model that having children is a woman's realm. Okay, so when you look at Finland, when you look at the European nations, they have a much larger number of midwives in their workforce, and it's a midwives-based delivery system. They do have obstetricians, but you go to the obstetricians, and the obstetricians, they function more so as consultants and for high-risk situations. In America, we don't have that. In America, we used to have midwives, and upwards of 75% of all births were delivered rurally in the country by midwives in the 1940s and 50s. But they had something called a Flexner report, where you basically had the Caucasian establishment try to determine what good medicine is, and the report that came out in 1910 said babies need to be delivered in hospitals. But what you have to understand is, in most hospitals, you don't have Black midwives, and you don't have women. You didn't have women or Black men who were actually on staff or could get staff privileges. So in essence, they were basically corner in the market on delivering babies. Back to Finland real quickly. It costs $12,000 to have a baby in America. It costs $60 to have a baby in Finland. They have more of they have a child healthcare model that basically covers the child from the time their conception to birth for the first 5 years of their life. And I think that when we talk about those things, those are just some of the things. So we talk about insurance, proper insurance coverage, a community-based system that we're basically here in America. Like I think most of the babies are delivered in Atlanta at Northside now. But what you have to understand is, that's kind of a medical center. And we're used to having our child at the biggest medical center facility that's in the area. Well,
and what I hear you saying, and I don't mean to just jump in here, but what I hear you saying is what's happening in Finland is like this community-based model where the community is coming together. They're valuing the life of the mom, they're valuing the life of the child, and they're removing the stressors from the situation of having a child by making sure that that the child is going to be well taken care of, and it's not going to be a financial strain to bring that child into your family, which is a huge stressor.
Absolutely. So now when we start talking about when you look in, you start reading about the stressors involved, the stresses that are involved that cause weathering and age our cause weathering, and the things that age the mothers. And when we talk about weathering is a concept that says if a Black woman has to deal with racism and all the strains of racism and overcoming certain issues, what it does is it adds years to their life. So even though she may be 35, her body may respond like someone who's about 7 years older, like she's 42. When she has a child, which puts her at high risk. The bottom line is that those intangible things are the things that they're doing in Finland, and those are some of the things that we can do as a community in America. And if you look at Casa Permanente, and you look at some of the other organizations and how they're trying to address this issue in America, what they're doing is creating a cocoon of services to surround that mother and placing that mother in the center of a kind of a cocoon, and adding social services like transportation, proper food, a safe environment where she can lay her head, stability in the home, adding those things to her cocoon. And those things are actually, we believe, are going to end up resulting in a better outcome for mothers.
Now, I also have to add too that probably unlike Finland, in America, when a Black woman encounters the healthcare system, there is a layer of bias there where she is not heard. And one way that that's being addressed is Medicaid and other insurance companies are now paying for doula services.
Absolutely.
So if you are a doula is like a health coach, a health advocate that helps you navigate the system, becomes sort of like your spokesperson when dealing with doctors and nurses.
The doula is your advocate. In Finland, they have doulas. They have doulas who play a major role, and they have midwives who play a major role in terms of, and the doulas play a major role in terms of, like we said, educating that mother. They are able to teach the mother how to care for the child, early feeding, and they are basically there to be an advocate for that mother. I thank you for mentioning the doulas, because that's one of the answers that to the issues, to the high incidence of death and complications for Black women. And that is, we used to have a built-in doula. If you remember, in a lot of our communities, we always had that auntie or that cousin who, whenever somebody got pregnant, they come stay with that mother and care for that mother. The baby's delivered, they stay with the mother for a month and a half afterwards. And that's consistent with what goes on in Ghana today. In Ghana today, if you have a child, a lot of times someone will come stay with the family who, and by doing that, they're an expert at advocating for that mother. And that's one of the messages that we were trying to get through in the Quiltmakers. And in the Quiltmakers, really the whole concept is that what we do is we have a community of women who are committed to becoming advocates for their sisters when they're having children. And that's kind of like one of the short stories that that we
that
wrote about.
was actually my next question. What was the
Yeah.
main idea that you share in the Quiltmaker to
Right.
galvanize a community response? Like, what is the call to action that you have embedded in it?
Well, with the Quiltmakers, and the Quiltmakers is a short book. It's on Amazon, but it's also on audiobooks. Just if you want to make it easy, go to audiobooks, or you can get it on Amazon or get it on your iBooks and audiobooks. But what it is I wrote it. It's a story that basically creates a community in the middle of Georgia, where the sisters are actually while every other county in Georgia is struggling with the high incidence of death for mothers, this one county in Lawrence County in Georgia has not had a death of a Black mother in decades. And what happens is a young anesthesiologist, a woman, comes down and stumbles on the fact that in her community, Black women don't die at the same rate as they do. And she has to ask herself the question, why? And what she finds out is that, years in advance, there was someone who recognized the problem that Black mothers were not being heard. And she put some traditions in place to basically guarantee that the Black mother, when they're at their most vulnerable, will be heard. The book, again, it's on audiobook. When you get it, we give partial proceeds to support the Black Women's Wellness Alliance in Los Angeles and stuff. And
Okay, we got that bi-coastal thing again. Now,
we help out.
I wanted to you raised another really important issue that you mentioned got you motivated, and that was your mom being diagnosed with triple negative breast cancer. That's a huge health issue for Black women. Black women get breast cancer at an earlier age and often get that more aggressive form, that triple negative form. What can women do to detect breast cancer in themselves? Because I know that's one of the things that you address in
Right.
Nana and the Bushwoman.
I do. One of the things that in Nana and the Bushwoman, what we do is we use art to heal. And if you notice, during Breast Cancer Awareness Month, people always tell you to check yourself, make sure you get your mammogram, but they also say to check yourself. But the reality is no one really shows you how to check yourself. And what we were able to do was actually using art to heal. The symbols on the bottom are actually Adinkra symbols that are 200 years old. And we were able to identify 3 Adinkra symbols. And Adinkra symbols are affiliated with like little parables. So it's almost like they're emojis. And the one stands for wisdom. The other one, the parable is about being versatile. The other one, the parable is about greatness. And what we do is basically use these symbols. We found out that if you move your hands in the pattern of these symbols, you actually move your hand in the way for a standard self-awareness breast exam. So in short, if you move your hand in these patterns and stuff, you're basically, you'll learn how you feel. If you notice, I use the term self-awareness exam. The self-awareness exam is how we try to get women to know themselves. Okay, it does not replace a mammogram. You should still be having your mammograms. And one of the things we want to note is, you remember they used to say do your mammograms at the age of 50. Well, they recently dropped the recommendations down to the age of 40. And one of the reasons they did that was because a lot of the Black women were actually developing breast cancer before the age of 50. And people will also go into a discussion, and some people will say, hey, we don't even want you to examine yourself at all. But the reality is that doesn't make any sense, because almost 47%, almost half of the breast cancers are actually detected by a woman feeling something that feels abnormal on their breast and going and getting it checked out. Okay, or
a partner,
feeling something by feeling a lump by mistake and just going and getting checked. So literally about 47 to 50% of the time, it's identified by touch. But and the other component that you have to keep in mind is everybody doesn't have access to good insurance and mammograms. And then when you do the mammograms, a large portion of women have dense breasts. So thank God they're developing new modalities and new ways of imaging the breast, especially in Black women, so that they can identify breast cancer earlier. So we're not saying when you do your self-awareness breast exam, what we teach is people how to approach themselves so that you'll be able to recognize what's normal in you, so that if you feel something abnormal, it's no problem. You'll go get it checked out.
And I think there's a lot to be brought out there. Number one, those Adinkra symbols are Ghanaian. They're from Africa. And so it's using
Absolutely.
our own traditions, once again,
Yes, they are.
to empower ourselves. And the other thing about
Mhm.
breast exams, self-awareness exams, is they're empowering, right?
Absolutely.
It's
I don't know if
fire
we'll
of
be able to show the video,
what's
but
right. And
yeah,
yeah.
but the
No, I
key
don't
is,
think we do, because we
yeah, no
do
problem.
actually have to go
Yeah,
to
we got to go
our
for
audience
your next thing.
questions. No, we don't
But
have to go. We just
but
have to
the
bring our
yeah.
audience into the
Okay,
discussion
no
so that they
problem.
can have a
But the
chance
key
to.
is what we do is we really do use what we do is we tell women to celebrate the wisdom, versatility, and greatness that makes them unique as a Black woman.
Absolutely.
And we believe that's a more uplifting and powerful message. And what we did, we have a doctor, Dr. Jesse Elliott, who used to do breast cancer work at Walter Reed, who basically shows people how to do a self-awareness breast exam. None in the Bushwoman's available on Amazon. We give partial proceeds for None in the Bushwoman to My Style Matters, a nonprofit that's located in Atlanta. And many of you guys may have seen us affiliated with the Pink Frog as well, which is a local organization. And we've also given partial proceeds to Sisters by Choice, which is which are Pink Frog and Sisters by Choice are both Atlanta-based nonprofit organizations that deal with breast cancer. So we always give part of our profits to the cause and stuff.
Fantastic. Well, Lila,
Mm-hmm.
Wayne, come on back in. What are we seeing in the chat?
On back in. We on back.
What kind of questions do we have?
So we have a question from Yvonne. And Yvonne says, how old does a person need to be to do a self-exam?
Oh, excellent question. And not fortunately, and Not in the Bushwoman, and this is kind of what the book looks like and stuff. It's the cover, and it's only $9.99, or you can listen to audio. And Not in the Bushwoman, what we do is we advocate people getting what's called taking an online screening survey between the ages of 25 and 30. Okay. And what that screening survey will do, it's affiliated with NIH. And when you take it, it'll basically tell you kind of like whether you're at high, medium, or low risk for breast cancer. And it'll be based upon asking you, hey, how many people have active breast cancer in your family and things of that nature. What happens is from there, you can use that to actually enter into a discussion with your primary care physician. Okay. Now, if you have a family member like a mother or a sister who's actually had breast cancer, then we want you to start checking yourself a little bit earlier, and you become familiar with it earlier, because each person is going to engage in starting their mammograms at different ages. The average now is what they're telling you is 40. Okay, but if you have a mother who's had breast cancer, if you have a sister who's had breast cancer, or is there a strong history of breast cancer in your family, then in that situation, you want to discuss with your primary care doctor, where you might start checking yourself earlier. You may they may start you on a different type of more aggressive protocol where they start checking you. And also, a lot of times now, you actually can get some genetic work done to basically help identify if you actually have some genes that put you at increased risk for it. Well, all of those things start. So between the ages of 25 and 30 is where we want you to start to take the online exam and learn how to do it. Okay. And get comfortable by the age, I say between 30, 35-ish, get comfortable in that window in terms of starting to do that self-exam. But the reality is we want you to know yourself as soon as, 25, 20 to 25, we want you to know yourself. And we want you to feel comfortable enough. For years, people have been trying to treat the Black female body as if it's something that only certain people should be able to touch, but they don't want you to touch yourself. No, it's okay for you to touch yourself. Okay. It's okay if you feel something, you talk about it, okay, and you ask somebody about
Right.
it.
And my roommate, from medical school, died of breast cancer at 38. It was diagnosed in her early 30s. So
Yep.
starting in your 20s is definitely
Mhm.
the time to start to be self-aware. So
Yep. Where you can become, and if you go to the B Edmond, www the B Edmond Project website, we have a video on there, an educational video that will show you and orient you towards this. That'll teach you how to use
yeah,
wisdom, versatility, and greatness to give
great.
yourself an exam. Okay.
Let's try
Dr.
to get in
Edmond,
some
what
other
I'm
questions.
sorry,
Yeah.
Dr. Mill.
Oh no, go ahead.
What is that test? The genetic test? What's it called? My mom had it recently, but I
Oh,
forget the
BRCA.
name of it.
It'll be the
Oh, right.
BRCA test. Yes, ma'am. And so what happens is the BRCA test is a genetic test. And the key is it doesn't mean that you're gonna get it, but what happens is people with that BRCA gene, just have an increased incidence of developing breast cancer.
Mhm.
So they usually will put you on a higher, I guess you could say a more sensitive type of monitoring program.
Mhm.
The other options that people have is to, if and BRCA doesn't just affect it kind of affects some other gynecologic cancers as well. Okay. But the
Right.
reality is if you have it and your mother has it, and I have a friend of mine, and it ended up saving her life because her mother had the gene and she had 3 daughters. And what she did
Mhm.
was, even though the mother passed away, she had the 3 daughters tested and had all of them put on a sensitive type of monitoring program, and it ended up
Mhm.
saving my friend's life. She ended up
Yeah.
getting her bilateral mastectomies, and she had triple negative breast cancer, but it ended up saving her life, thank God, and she's alive today
So
and
important.
doing well. So the reality
Okay.
is there are genetic tests that can help.
And
Mhm.
and insurance does cover those
Yeah.
Yes.
genetic tests when indicated. So that should
Mhm.
not be a barrier to getting them.
Not at all. But you want to know your body, age of 25 to 30, and with using the technique that we have, it's an approachable way for you to actually learn about learn yourself.
Okay.
Well,
I
yeah,
have lots of questions from the West Coast, Lane.
go ahead.
One
Let's
of
go.
them is just about what you said, Dr. Edmond, and you too, Dr. Mel. And it sort of got lost in there. But Dr. Mel, you said you shouldn't just know your body. You should definitely know your body. But if you have a partner,
Yeah.
they can certainly identify some abnormalities, right? So they can do
Yes.
those same
Mhm.
exams
Right. If
on their partners.
in terms of
Well, the
intimacy
thing
and
is that
stuff,
yeah. Go ahead. Yeah.
I think in terms of intimacy and stuff, where you draw the line in terms of intimacy, and this is one of this ties again into Dr. Mel, the great question you asked. You said, "Hey, why is it you're a man and you're involved in women's healthcare issues?" The
Mhm.
key is, I don't. If you see yourself as part of a community, if you see yourself as
Mm,
part of a family, then the key is, I look out for her back, she looks out for my back. Okay.
right.
But the key is if he feels something, he can learn that, and however you guys integrate that in terms of your intimacy is just fine. But the main thing is to understand is to give the woman the license and the wisdom to approach herself. And the reason you want to do that is if you do have a breast cancer, the women who actually perform self-awareness breast exams actually have a slightly better outcome in the long
Mhm.
haul. And I think it has to do with the fact that they're comfortable with themselves. They're already been educated about breast cancer awareness and stuff. They know
Mhm.
themselves. And but I can't explain. I don't know exactly why. That's just my guess on why. But if you look at the data, you can't argue with the data. If you have
I
been
think
practicing self-awareness breast exams and you do develop breast cancer, you have a higher survival rate than if you're just starting off, if you're new
and
to
I
it.
I the name of everything we do is under Be Health Empowered, right?
Hmm.
And I think when you have agency and when you're
Yes.
engaged, you're always going to have better health outcomes, whether it's breast cancer or anything else. The
Hmm.
data definitely backs that up.
Yeah.
Yeah. I had two masses removed because I was doing my self exams for a long, long time. And turns out I
Mhm.
just have very, very dense breasts. But I think it's
Right.
important to just know your body.
You do.
One more question for you, Dr. Edmond. Can you go back to what weathering um, meant?
Absolutely.
Can you break that
Absolutely.
down?
And this is not, and keep in mind, this is not this is not necessarily this is not my concept. What I do is I read the articles and I go to lectures at the NMA, and I think it was
National
Dr.
Medical Association.
National Medical Association. I think it was Dr. Fatua is a obstetrician who works at Northside right now, who worked for Kaiser Permanente. And I saw she had an excellent presentation. But what you have to understand is people believe when you one of the reasons that some people speculate that Black women have such a worse outcome is because in terms of dealing with racism and the pressures of racism and the other factors like of stress and that come from racism and living in a racist environment, that ages the woman's body. Okay. And because of that, some people believe that that contributes to why Black women don't do as well. So in other words, you think that you're taking care of a woman who's 35, but in reality, her body, because of the stress and the pressures of functioning in America, her body may actually be at the level, function at the level of the age of 42. And what you have to understand is everybody asks this question and stuff, let me tell you, I gotta hip you to the rates. Okay. Number one, if you're under the age of 25, your chances of death is about 20 per 100,000. When you're talking 35, it goes up to about like 29. But the key is once you get to 40, it goes up to about, this is for white women. Once you get to the age of about 40, it goes up to about 130, 34 per 100,000, okay, births. So if you're over the age of 40, even though you got to understand if your risk of death is about 7 times, what's 20 divided by almost like 7 times that of a person having a child under the age of 25. Now, here's the kicker, and the data's coming out on this. If you are a Black woman who's over the age of 40 and having a child, your incidence of the frequency of death is actually 300 deaths per 100,000. So it's 300 divided by 20. So it's 15 times the rate. So the key is they believe that weathering is one of the reasons for that, because we have to deal with that issue. I'd be remiss if I didn't tell you the importance of making sure that we got to make sure that people are heard, because the full title for the Quiltmakers is the Quiltmakers, the art of hearing a Black mother's cry. And one of the common things that I found is that Black mothers are not heard in the system. So you have to have that doula advocate. We have to give our husbands and support systems the license to amplify your voice. And that's what we try to teach.
Husbands, aunties, sisters, cousins, whoever it is,
right.
or doulas. And I think women should know that if 50% or so of births in the United States are covered by Medicaid, more and more states are, like I said, paying for doulas. So everybody should know to ask for a doula, whether you're on Medicaid or not.
Right. And especially there was at the NMA, they had some doulas from New Orleans, and those sisters were on point. And the reality is that doulas are meant to be your advocate during that 6-week period after you deliver that child and stuff. And normally it would be a family member, but the reality is everybody's moving across the country right now. So, and one of the trends, believe it or not, is some women are starting to move back home to have their child so that they can be in a more supportive environment around their mothers and fathers and in a stronger financial situation with less stress for having a child. But I do want people to just remember those numbers. Black women die at 3 times the normal rate. 60% of the deaths occur after the child is born. And that's where we're trying to get the fathers and support systems to focus on supporting the mothers. And then the other thing is that 80% of these deaths are actually thought to be reversible.
So I like
thought to be avoidable.
I got to interject here because I'm the out of time guy. So we are out of time, but I want to remind all our viewers and listeners that that book, The Quiltmakers, if you're Amazon Prime member, is free free
Yep.
tonight. So
Free.
if you're watching this, you're Amazon Prime member, go
Yep.
download that. Use your Amazon Prime 2 audio
Cool.
books and all that for this incredible book.
Before I close,
and I'm going to turn it over to Dr. Mel.
Yeah, we got to take it. We got to sign off. Thank you so much,
Okay.
Dr. Edmond, for being
it's
here.
It's a blessing to be here. Call me anytime. God bless y'all.
Of course. And thank you to Wayne and Lila. Welcome back, Lila. So glad that you were here. And before I go, I have to tell you all, my Be Health Empowered family, remind you about that study at Howard. It is still going on. You have about a month left and counting to enroll in the COVID resilience research study. It's totally voluntary. It's filling out a couple of surveys, and you can be compensated up to $100 for your time. So if you have any interest in doing that, just reach out to Dana Harvey. You can email her at danaharveyresearch@gmail.com. That's Dana, D-A-N-A, Harvey, H-A-R-V-E-Y, research@gmail.com. All right. Well, thank you so much, my Be Health Empowered family, for joining us for yet another episode of Excuse Me, Doctor. Until I see you, remember, be wise, be well, and be health empowered.
I'm on fire. This one here is vaxxed and boosted. My little brother has asthma, which means he's 6 times more likely than a healthy kid to go to the hospital.
Dinner.
Uno out.
You cheated. I'm not doing the dishes.
If I play my cards right, I am so glad they let me in.